Good morning. Welcome to Medical Monday. Dr. B back with another edition of our atopic triad discussion. So asthma is where the child gets sick and develops wheezing, shortness of breath, difficulty breathing. This is serious and can be triggered by many different things. Again, some of the same triggers that we had in allergy and eczema, we also see as triggers for asthma. So the primary trigger for asthma is upper respiratory infections, viruses we catch of all different kinds. They irritate our chest, they make us cough. And in someone who has this atopic triad, they have more sensitive airway. And so they're going to have the same kind of reactions that we had in like nasal allergy, where you get the swelling and mucus production, but they're going to get swelling and mucus production in their chest. That makes it very difficult to breathe because now we're getting swelling in the airway and mucus in the airway. There's a second component of asthma that makes it worse, and that is that when the airway gets irritated like that, there's smooth muscle in the airway that makes the airway constrict even further. And that's what we use albuterol for. Albuterol is that puffer that we use, or the breathing treatment, which will relax that smooth muscle and let it expand. And in asthma, we sometimes have to give a steroid to reduce some of that swelling that histamine causes, which will also help to reduce some of that mucus production. So in asthma, we have a two-pronged approach. We oftentimes use a steroid for a more serious asthma exacerbation. And then for less serious, we use just the albuterol that relaxes that smooth muscle and opens up those airways. And the triggers for asthma can vary. One of the other ones that is a common one we see with a lot of kids is exercise-induced asthma. Exercise-induced asthma occurs when we're running, or we're participating in sports, or we're doing something where we get breathing hard, and that's actually what causes the irritation, and we get some contraction of that airway, and we need to use a puffer. For the older kids that are school-aged, one of my favorite things for them to use for their exercise-induced asthma or their asthma in general is an aero chamber. And I want to do a special video just by itself to explain that, but it's basically a spacer device, so they're not just using a puffer in their mouth and spraying it on their tongue. They're actually spraying it into a chamber, and they really get it down into their chest where it works much, much better. So we're going to talk a little bit more about that next time. But again, the third and final piece of our atopic triad is asthma, and it relates right in with our eczema and our allergy and our family history of that sensitive allergy-mediated disease process. Thanks for watching.